I'm Alan Stillman, and my presentation today is about Stroke Smart Alexandria, and it's basically a community-based public health campaign to reduce pre-hospital delay for stroke treatment in the city of Alexandria. So just a little background on who I am and why I'm doing this. Um, I'm the CEO and founder of QuickPoint. QuickPoint is a design and communications firm, and we primarily work with the United States military. And what we do is we produce publications that allow soldiers to communicate with locals, specifically to get information about threats, that could endanger our U.S. military. The main threat out there, in the Iraq and Afghanistan conflicts, has been those roadside bombs referred to as IEDs, improvised explosive devices. And on the screen now, you're just looking at some photos of our publications being used to communicate with soldiers using pictures. Our whole focus is visual communication to get the information. Um, and let's see, let me jump to the next one. Um, what you're looking at now is one that's specifically focused on understanding what an IED is. I've been working for the military with the military for over 10 years doing this, and we found this incredibly effective to get the information they needed. It became standard issue for the U.S. military for over 10 years. We found thousands of IEDs, saved countless lives. And the big challenge was is that an IED is difficult to recognize because it's improvised. It can manifest in many different ways, and more so, it's hard to remember all the things to look for. And it started to hit me that in some ways it's a little bit like stroke because there's many different ways that a stroke can show a sign, and it's difficult to remember them all, particularly for the lay public. Um, so that's a little bit about where I come from. Um, why am I personally doing this? Why have I made this sort of a mission or a big part of my life is when I was 12 years old, I was raised by my mother and grandmother Rose, who's pictured here. I didn't have a father. And when I was 12, my grandmother had a stroke, and my mother waited more than 24 hours before calling 911. And my grandmother had a horrible outcome, completely aphasic, never spoke again for the rest of her life, completely shut in. She lost all, she was fully paralyzed. And I can remember being there as a child, just like looking at this woman who raised me. She was my parent, holding her hand and not getting why she couldn't in any way interact with me. And it just kind of broke my heart, just so broke my heart. My mother, who struggled with depression already, fell into a really deep depression and shortly thereafter was overdosed on sleeping pills. And so I lost both my caretakers, both my parents, because of a stroke, and ended up being raised in a foster home. So I just really wanted to see if I could somehow do something that would lessen the likelihood that people would have to go through things like that. Um, so that being said, what is my goal? To reduce pre-hospital delay. As you well know, there's sort of three core parts of getting somebody treatment. Of course, getting the needle in them, or the mechanical thrombectomy, and that time is getting lower and lower. Over the last 20 years since TPA has been invented. The EMS transport time, which again always getting better in the communication with the ER and about stroke. Just amazing strides in those two legs of stroke treatment. But that initial leg, that last known well to when they call 911, is where there's a big gap and a big room, a lot of room for improvement. And that's really, what my focus is about. Um, so, what are the basic reasons for pre-hospital delay? I see it as falling into three categories. First is just low awareness of even what stroke is. I give regular presentations, and when you mention heart attack, CPR, somebody collapsing on the floor and not breathing, everyone knows they need CPR. They may not know how to do it, but they know that's what needs to happen. You give the example of somebody choking. Everyone gets that they need abdominal compressions, they need Heimlich. But you start to talk about stroke, people don't even know stroke is about brain. People blur it with heat stroke. They barely know the basic awareness of stroke is much lower than it should be considering its prevalence, in our public health system. Um, Second, I call health education. There's been a number of systems out there to educate people how to remember and respond to stroke. fast, be fast, 10 signs. There are other things out there. It's just a challenging health education problem. What you're looking for is long term retention, that whenever the person gets educated about stroke signs, they may not need it for 5 or 10 or 20 years. And then when they do need it, they need to recall it under duress while they or a loved one is experiencing stroke signs. So it's really just a challenging health education problem. Collapsing is sort of obvious. Somebody choking on a piece of food is obvious. Stroke is so not obvious. Then the third piece, the most important one, your behavioral response, that they call 911. And, I've been reading the studies about what people do instead. One of the biggest ones is they call their primary care physician. They drive themselves to the ER. They wait for it to pass. They take a nap. They do all sorts of things. And I just want to drill down for a second on, calling the primary care physician. What happens when you do that is you get a receptionist who answers the phone. And that person's job is to schedule appointments. That's what receptionists do. And we looked into it. And as far as we know, there is no requirement or training for medical receptionists to triage for stroke. We couldn't find it out there. So just something that maybe we can do is, if those medical receptionists were triaging for stroke, they wouldn't say, oh yeah, we can get you in next Tuesday. They would go, oh my God, they'd either get a nurse on the line or dial 911 or realize I am talking to someone who's likely having a stroke. And so there's a real room for improvement there. Um, in terms of how I approached this, it basically has two legs: design, which is where I come from professionally, and community outreach, where the people are. Let's talk about design first. So when I looked at design, my first focus was the visual, and we decided to focus on the two things that were easiest to comprehend and easiest to memorize, the drooping smile and the arm raise. And so you see that we have a lot of our energy goes into that. We went through 14 designs, did focus groups, spent a lot of time figuring out what will people get right away, and emphasizing that if you fail either one of these tests, you call 911. We posed it as a test, which has been out there, in public health protocols, to make it active. Stick your arms out, smile. Either one's failed, you call 911. Then we looked at the motivating statistics, quote, the scary statistics, and found that these particular ones seem to scare people well. The 1 in 6 number, long-term disability, frightening, 2 million brain cells a minute, a horrifying number, the prevalence, 80% of families affected. And then we picked 5 additional signs to catch, as many kinds of strokes as possible, similar to the be fast thinking. And then we embedded the call 911 throughout it. A lot of people would think, well, do I need 2 or 3 signs? How much does it take to call 911? Like, no, just one sign, you call 911. Any one of them, you call 911. So that's kind of the visual design. The physical design, we used 3 form factors, 3 formats. The first one was a wallet card, and I'll show it to you physically in a minute, without being in PowerPoint. But the goal there was retention, repetition, and access. So retention, we want people to get something that they will hold on to for a long time, physically have in their wallet for a long time. Repetition, that they'll look at regularly. We always kind of, move credit cards and do a little, wallet maintenance as we push things around. Every time they touch it, there's a chance to kind of like, oh yeah, stroke, I need to remember that. And third is access. So if somebody sees a loved one, sees a neighbor, thinks that maybe I'm looking at a stroke, they're like, oh yeah, there's that little card with the red border I have, isn't it? Let me check this out. Oh yeah, let me ask them to put their arms out. Wait, their speech is fuzzy and funky. Oh, that's a stroke, or that, is worth calling 911. In addition, we used a paper we work with on the military that's tear-proof, waterproof, and long-lasting. So literally, when they stick that in their wallet, it will be there forever if they choose to keep it there. And then we designed it to be a little bit larger than a credit card, so it has this red border on it. So you always just remember, red border, that's the information. So that was our physical design for the wallet card. We also made magnets, refrigerator magnets. Same thing, we want you to retain it, put it on your refrigerator. We also make it as stickers in case your refrigerator doesn't have, metal that's magnetic. repetition, you look at it regularly, and access, you always know where it is. We did everything in English and Spanish. You see the Spanish on the right for all our materials. And then we always came up with good displays so people can easily put it out. We want to make it as easy as possible for our partners to put this material out so they're not even looking like, well, how do I put this out? Um, and then the last piece was a poster. And again, the idea with the poster was community exposure and saturation. It's a high ask that somebody will look at a poster once, while waiting online and remember these things. But every time they get another exposure, another saturation, they're there. Now I'm going to jump to me for a second and just show you what these things really look like. Um, Hopefully you can see me now. And let me pull this here. So let me just start with the wallet card. So the wallet card, again, we always give people cases if they want it. And this wallet card literally is completely tear-proof. Sometimes to get people the novelty of it will ask them to tear it, and it's impossible to tear. Again, waterproof, durable. Give people these little cases. And then let me explain this wallet idea. So again, it's just slightly taller than a credit card, which virtually everyone has. You just sort of get this little red strip, and hopefully people hold on to it that way. The magnets look like this, just a refrigerator magnet. And again, when we provide it, we offer these cases, and everything's free, and give people these nice acrylic cases so they can just easily pop it out. And then the third is the posters. And again, we do everything in English and Spanish. If people want, we give them these acrylic holders. So they just have an easy way to put it out and display it. You just want to make things as easy as everyone to support this. As soon as someone has to figure out, what do I do with this, there's that greater chance it just goes into a drawer and goes away. Now, if I can go back to my presentation, let's see, share screen, and you should be back at the poster. If not, somebody tell me otherwise. Okay, now let me talk about the community component. That was just the visual and the physical design. I'm in the city of Alexandria, and the mayor of Alexandria, Mayor Silberberg, was mayor at the time. Turned out her mother had a stroke as well, and we sort of both felt passionate about making a difference here. So we declared Alexandria a stroke smart city. As far as we know, we're the first stroke smart city in the nation. What does that mean to be a stroke smart city? Well, first at a city level, the mayor and the 6 council members, or a 7 councilman city, officially voted or approved the idea that we're a stroke smart city. It was actually just 3 years ago, October 2017, that this happened. And the city offered create something called a proclamation, which is not exactly a law, but a public proclamation that the city will be committed to stroke awareness. And what's wonderful about this proclamation and the Stroke Smart City designation is that you can now go to almost any partner in the city, and it's like a license for them to say, sure, I'll help. And so you'll see, I'm going to go through a lot of the partnerships we have, but virtually everyone says yes. I don't know if we've ever gotten a no, we don't want to support this, because you've got the city's approval, and who would not want to help people recognize stroke and call 911? It's like a zero controversy issue, which is so rare in our world. So it's really, really pretty amazing. So this is sort of our license to get help from our community. So within the city government, this is an example of 10 of our partners. But cities, I've learned, have many different components, and we went to each one of these. When I say city employees, these are the ones that are not forward-facing to the public. I think we have close to 2,000 people that do everything that happens in a city, from fix roads to garbage men to give out, tax forms. And we made sure that the entire city, got educated by these materials. That was kind of our first thing. And I'll walk through some of these other departments as we move forward. Then in addition to the city as a partner, we had other community partners. We started with senior organizations because of the high prevalence of stroke with seniors, and they were so supportive. They were completely on board to help any which way they can. Local businesses, civic organizations, which is like this broad category, churches, synagogues, Rotary clubs, there's all sorts of civic organizations within a city. health organizations. One of our key partners, maybe our most important partner, is Inova Alexandria, because they're the ones we want to reduce the pre-hospital delays so they can get there and get treatment. I'm pretty sure Ali Pinch is online today, and one of the people, and they've just been a core partner in making sure this happens, and we do the good work. In addition, pharmacies, health fairs, NBH, you probably don't know, is Neighborhood Health. They're the FQHC, the Federally Qualified Health Center in our area. I think they service like 15,000 people. They've been a really important partner. They have a very high Latino patient base, so the fact that everything was in Spanish worked well. We've gotten a lot of help from local media as well. There's 3 newspapers in the city. They've all done stories about it. I had the chance to do a TED Talk. You guys probably know those TED Talks, and that's been a great mechanism to move through social media. And we've had some local TV as well. Let's see. So now that we have the materials, now that we have the partners, what do we do with them? Actually, what's the process once we get in front of these various constituencies? So the first one is give stroke presentations. Just me getting in front of a church or a Lions Club or whatever, just giving a talk, 10 minutes, 30 minutes, whatever, however long they want, and giving a presentation about stroke sign awareness and all the importance of calling 911 and stuff. The second one is the distribution of the materials, just getting these materials out in as many places as possible. And the third, and in some ways maybe the most important, is what I call recruiting and supporting stroke champions. And I'm going to drill down a little bit on what I mean by a stroke champion. And oops, missed it. Oh, actually, I'm going to come back to stroke champion in a little bit. Okay. I want to just show you some photos of some of the partners. This is one of our best partners, the Alexandria Police and Sheriff's Department. We did a total of 22 trainings and touched every policeman, sheriff in our city. We also got into the jail system. We got into the court system. We got parking attendants. We even got the crossing guards. Anyone that had, any kind of badge or authority in any which way, we got into the system. And one of the things we learned with police is that somebody driving that's intoxicated kind of looks a lot like somebody having a stroke. So we really emphasized that. And it turned out one of the mayors of Alexandria some years ago, Mayor Ewell, actually had a stroke while driving, crashed into some garbage cans. I met the policeman that pulled up. He first thought, I've got a drunk former mayor. This is kind of awkward, who had a car accident. Turned out EMS came and we realized it was a stroke, and he got treatment right away and is doing fairly well. But really important for them to get it. And then you see, I purposely put in a picture of all the materials there. There's probably 300-400 copies there. Any one of these people started to become partners in that any policeman would take 20, 30, 50 pieces and find ways to give it out within their communities. So we started to get this multiplier effect that when you gave the materials out at a presentation, you got it to many other people. This is the Virginia Department of Health. They've been a great partner. It's in their fairs, it's in their exam rooms, it's signage in their buildings. They have 6 clinics, it's in all their clinics. They've really been a natural partner, of course, the Virginia Department of Health. I want to talk in some depth about the school system. Schools are a huge part of any municipality. The city of Alexandria is a population of about 160,000, 16,000 students, 700 teachers. So, right there, that's 10% of the city. But these students have, parents and grandparents and neighbors. So these students potentially touch 20, 30, 40,000 people. Did some research, and they use the term child-mediated health communication. And a lot of organizations have found that particularly with ethnic groups, you can use the children to take the health education and bring it home and pass it. And that's what we decided to do. And so what you see here is a poster, a teacher in a classroom, and talking with the students. We learned the first thing you have to do, particularly with younger students, is make sure they understand 911. You can't tell somebody to call it if they don't even understand what happens when you do it. And first, second, third graders may not at all. So we had to work on that. We had to come up with scripts to practice with the teachers. We had to have different scripts for different age groups to, make it age appropriate. So that's what you're looking at here. And then here you see the teachers giving out some of the materials. Um, the way this worked is every student, got the magnet and the cards. They also got a letter from the city to the parents explaining what your child has. Please put the card in your wallet, put the magnet on your refrigerator. The students were given the assignment of explaining to their parents what they learned, to actually go through and show their parents how to spot a stroke. So you get this kind of effect of the child's interested in this, is giving you materials, you got a letter from the school, you get this emergence of different things going on. And one of the things we did is we always had the students actually practice with each other doing the arm test, doing the smile test. So they actually got the children physically engaged. And another thing we did is we asked these children if any of them ever had a family member that had a stroke, and hands went up, hands went up. So very quickly kids got, this is important. I could be losing my grandfather or saving my grandfather. And we started to call them little stroke champions. So they got, excited about it. Um, so, um, here's another community. This is Allie, who I think is out there. I hope it's okay that I'm showing this nice photo of you. But this is working with Inova Alexandria at one of the community health fairs, and you can see they're actively displaying and giving out the materials. You see it in English, and you see it in Spanish, which again, Spanish, at least in Alexandria, is really important. We have a lot of Latino Spanish speakers. Um, this is a pharmacy. We got it into all the giant pharmacies in Alexandria, and actually so far have it in 7 pharmacies. Really want to emphasize pharmacies were a wonderful place to do an intervention. It's well known that if you get health education material from a health professional, you're going to pay more attention to it than if you just find it anyplace else. But the pharmacists were aware who was on high blood pressure or diabetes, age, ethnicity, so they could sort of naturally figure out who really, really should be aware of this. So we came up with these pharmacist tip sheets and really said to them, if somebody has a higher demographic based on the medications they're on or whatever, really take the time to take a couple minutes. And the pharmacists were really fine with that. So we had pharmacists having these one-on-one conversations with people that were at higher risk, saying you really should remember this, take the magnet, take the card, and it's sort of a great intervention. We're hoping to find ways to scale this with other pharmacies, potentially nationally someday. Um, this is an example of the local business community. Um, Talked to something called the Delray Business Association. 30, 40 people attended. These people own hair salons and coffee shops, and they're realtors. So these people can then again spread it in scale elsewhere. In terms of making it easy for people to put it out, we have these different cases. We found creative ways we found a little case you can pop on a bulletin board that'll hold 100 cards. So it's not just the poster on the board, but 100 cards so people can look at it and take one. We learned, if you look at the lower right, you can just use binder clips and magnets or thumbtacks, other cases. Again, we just wanted to make it really easy for this coffee shop owner or this hair salon owner to find a simple way to put it out and have it out there with their community. Okay, now back to stroke champions. So this concept of helping somebody carry the message beyond just their personal knowledge. Came up with 3 simple reasons why someone should consider being a stroke champion. So one, every time I take the time to say to somebody else, smile and arms and speech and numbness on one side and balance, I'm burning it into my own long-term memory. I'm making it that much more likely that I'll remember it if my day comes or my loved one day comes. So the reinforcement. The second is you're helping, others, you're helping these other people learn to spot a stroke, which, everyone should know. And third, others can help spot them in you. We help people realize that if you're having a stroke, it's difficult to be self-aware enough to call 911. And I think something like 90% of strokes are called in by witnesses and bystanders, not the actual person having it. So we'd say, educate your people around you to be sensors for you. This is a community process. If everyone knows it, we talk about herd immunity with, COVID. Let's get, herd literacy with strokes so everyone knows this, like we kind of have with Heimlich. almost like that term, herd literacy. But in any case, so what do we ask these stroke champions to do? Um, um, Educate their friends and family, sometimes even have them write out who they're going to do it to. Adopt a bulletin board, which means literally, find a bulletin board you go to, pop it up, and then maintain it. So if a month later it's been taken down, kind of like adopt a bulletin board. Um, Commit to a local group, some community they're in, and then as much as possible spread the message via email and social media. And some of the places where the stroke championship model has been particularly effective is house of worships. We've gotten one Catholic church through the priest and an Episcopal, not Episcopal, I think maybe Baptist church, to commit to get the entire church these materials. They put it out in different ways and, Sunday after services, but basically to, get an entire church to have some level of stroke literacy. A lot of success with the Spanish speaking community, a more difficult community for me to personally interface with since I don't speak Spanish, but we got people there like, wow, our community needs to know this. They're taking hundreds and they're finding different organizations within the Spanish speaking community to champion it to. Local newspaper. We have one newspaper. It's one of these free newspapers that goes to many locations. You see it when you walk into coffee shops and restaurants. And we got their driver every time he put out a stack of newspapers to put out a case of wallet cards. So this one way we got 100 locations putting out the wallet cards, just putting it next to these local newspapers. And the newspaper driver would just check, can I put these there? And as far as we know, no one said no. Again, who's against stroke education? It's a very easy uh, way to get cooperation. Senior Services of Alexandria is our local organization for senior services. They've been amazing. They have a team of people that regularly replenish it in rec centers and senior centers and libraries. They've really, touched hundreds, if not thousands of seniors. And just they call me up, we need more. They're really a major championship organization. Long-term caregivers associations, they have ways of touching, again, large multipliers. If somebody's doing caretaking on a senior, you really want them to know how to spot a stroke. They're the ones that are in front of that person, possibly daily. And so we made sure we got as many of those outreach. Social workers for the city. A typical Alexandria social worker could be going into 100 different homes, in a period of months. And we got them to carry the message to these homes. So we've got these great champions with nice multiplier effects. In terms of the success or the measurement, so this is what I can tell you from 2019. Last year, we got 50,000 pieces of materials out, the cards, the magnets, and the posters. We're well over 100 distribution points from, libraries to restaurants to salons to town hall that, these materials are around the city. I gave 27 presentations in 2019, 6 forms of media going out there. The TED Talk is nice. I think it's got 3,000 or 4,000 views of it. 4 community health fairs. The one that's probably most relevant to you guys, being the clinical workers, is what's happened to the treatment and needle volume. So we actually just started to get some of this data in, and it looks like the last known well to needle time, or the stroke treatment needle, is moving in the right direction based on INOVA Alexandria. But I really put a star here because this is just sort of a first high level look at the data. It hasn't been, to really make a claim in this world, you need a biostatistician to look at this very tightly, and do a study and have peer review. So I really put this as very just like an indicator, but I don't want to make any hard claim at all, because this, in fact, one of the things I'm hoping maybe somebody out there can help connect me to someone who could really look at this data and see what's publishable. And then we're waiting the last known well to 911 dispatch from our EMS department, but they have that data. And then this one I want to point out, I call increased stroke awareness in an informal way. Whenever I sort of talk to someone, a neighbor or somebody in the city, I said, have you heard of Stroke Smart Alexandria? The vast majority of time people have. I've talked to people that said, yeah, I've got this in my wallet, and they pull out the card. I've had EMS people tell me they go into homes and they see the magnet on the refrigerator. So we're getting out there, at a qualitative level. We feel pretty confident. Um, Patrick asked me just to mention about impact from COVID. And Well, the most obvious ones is that, because of lockdowns, there's no personal person-to-person presentations going on. There's reduced capability to get to the partners and just anything because of lockdown. Public health right now is so focused on COVID. I'm much less asking them to take any of their bandwidth and put it here. I've moved to online presentations, like this one. Thank God for Zoom. It allows some capability to get out there more with digital media. And I'm actually came up with a way to email people a digital version of the materials they can cut out and put on their refrigerator or put in the magnet. People give like a self-addressed stamp, SASE, self-addressed stamped envelope, and it goes out there. So we're adapting and adjusting, but it's tricky. Um, and then just a little bit about going forward with Stroke Smart Alexandria and the Virginia Stroke System Task Force. First, I welcome, now or whenever, any guidance on ways you think this could be more effective. You guys are the people that live in this world, and my goal is to help you do treatment. Um, I'm happy to donate these materials, even though this is an Alexandria program. I'm happy to mail you, as many of these cards and posters, or give it to you in digital form if you want to print it out with your hospital or city's name on it. Like, any way I can help you do this, let me know, and I will do that to the best of my ability. If you can, there's strategies to get this into primary care physicians' offices, both so the staff know it, and then what better way than like in one of those little waiting rooms where you're getting your blood pressure taken to have this on the wall. I haven't figured that one out. I'm more than happy to present to other communities in your localities, particularly now with Zoom, and particularly if there's any health researchers out there that you think might be interested in what we're doing here and want to kind of drill down, particularly on the data, and see if there's something worth documenting and publishing, that would be wonderful. If there's other cities that think they want to be stroke smart cities or counties, I'm sure our former mayor would happily talk to their mayors and, kind of do that mayor to mayor thing. And then ultimately, maybe this could someday seed a stroke smart Virginia. Alexandria is the first city in the nation, as far as we know, to be a stroke smart city. Wouldn't it be wonderful if Virginia someday, particularly with a governor who's a pediatric neurologist, wouldn't it be wonderful if we could be a stroke smart state and get our whole state to really know this? So in the slide deck, which you'll get, is some of the links to the video. And then I'm going to send a separate document that has all these materials in digital form, so you could print them out any which way you want. And with that, I will go to questions and comments.
Mr. Stillman, thank you very much for a fantastic presentation and such passionate and far-reaching work. Alexandria is really lucky to have you, and we hope we can entice you to do something similar on the state level if you would be interested in working with VSSTF. There's plenty of interest and support from all the comments that we're getting. We would love to have your expertise and your experience to lead this work.
Sure. I'm happy to help any way I can, really. I've made this a big part of my life as a human being.
I have a question, and I'll turn it over to others for any additional questions, and I'm sure there are plenty. Is there an app in development that can be sent to communities based on interest, like you mentioned, salons, churches, libraries, schools, where people go gym? Is there anything in development?
So we looked at doing apps. My company's done app-like stuff, but we found that the chances of somebody feeling a little bit off, pulling out their phone, checking through their 100 apps, which one is a stroke, just didn't seem that likely. And there's stroke apps out there. So we actually thought that physical wallet cards, magnets, and paper physical things were better than digital, if at all possible. So we did not do an app, but there are stroke apps out there, bunches of them.
All right, let's see, we have a few questions. We have Ms. Wabish, who has a question for you.
Sure. Sorry, I can't hear it.
Can you hear me now?
A little bit, yeah.
Sorry, I'm in a room with other people. I just put my questions in the chat. You can look at that.
I'm sorry, it's really hard to hear you, like really,
She said
really.
she's got a mask on and can't talk well, but her questions are in the chat.
Oh.
Okay, so let me read what she's writing. So one question is, are you considering changing to be fast?
So no. We looked at some studies on FAST and the whole idea of using a mnemonic as an acronym, and it found that people had trouble with it, just with FAST, that when they went to, like sometimes they would even remember the face and arms, but they didn't quite remember the speech. The fact that it uses, it's a little technical, the fact that it uses the first three FAS are signs, but T is time, actually works against it. FAST was originally developed in the UK in the early 90s, I think, or mid 90s, for paramedics to remember, who do it all the time. But it was never really tested for the way it's being used. So I'm reluctant to talk too much against BFAST because I know it's been highly adopted, but I live with a professor of linguistics, and this is my field for 30 years, and I don't think it's the best way to educate the world about it. I think there's better ways. So that said, when someone uses BFAST, anything is fine, but I think there's just better ways, and I've read the studies that actually confirm that it's not the best approach.
This is Robin Scott. I actually just have a comment. I'm actually the chair of the Virginia System Coordinators Consortium. I love your community effort, and I love your passion and your spirit around this, because that's kind of similar to my passion, and just wanted to make that comment and say that my daughter and I had developed a coloring and activity book that we use when we go out to the community, and specifically for the elementary schools, when we're talking to the elementary schools, and we've actually presented at seminars. And have you done anything around presenting at seminars around stroke and larger tables of that sort? Would that be a helpful? Is that I'm giving that as a suggestion?
No, that's I'm not. I would be happy to support that and be part of that. Maybe you and I could talk more, because
I was going to say, and if you and I want to talk more, and I can show you my coloring book, I'd be more than happy.
Yeah, I'd love that.
Okay, good.
Hi, Alan. This is Craig from Northern Virginia EMS Council. I got a couple questions for you, but I want to make sure that Lauren's get followed up on, because she put a bunch in chat. So her second question is, have you reached out to anyone at Inova Alexandria Mount Vernon Hospital? Because they're in Alexandria, but the county of Fairfax. She's in charge of the stroke education group there, and would like to connect with you. So I think she'll probably email you. And then her third question is, do you have connections at food pantries? Have you considered food pantries as an outlet?
We've done Meals on Wheels, but no, that's actually never thought about food pantries. That's another good idea.
And another concept she had was virtual health fairs, since we're in the COVID community. They've had to cancel several health fairs with faith and community groups. And I was just wondering, I guess she's wondering if your virtual presentations have picked up this year as opposed to your in-person presentations.
We just kind of figured out how to do virtual, to make this work virtually. So, yeah, I never even heard of Zoom till a few months ago. So maybe we're a little slow there, but if there's any virtual health fairs out there that you think this would be appropriate, I'd be more than happy to do that. I just actually know how to do it now.
Sure, perfect. And
hi, this is Allie. Can you guys hear me?
Yeah, go ahead.
I was just gonna take the Inova question. I'm actually talking with our fellow stroke coordinators in Inova, and I'll be reaching out to Alan to set up an Inova maybe presentation for everyone in Inova, Lauren. That way we can all collaborate together.
Perfect. So to get to my questions, Alan, thanks. I've seen you present before, and I'm glad to see you here today. You're a great champion of stroke. So a couple questions from a larger perspective. If a mayor were to come to me and say, oh, what does it cost to be stroke smart? I was just wondering about what is your annual budget? Like how much money do you spend on printing and everything? And I know that your company does a lot and you give it away, so it's very inexpensive for the city of Alexandria, but Alan doesn't live everywhere, unfortunately. Um, so I was just wondering if you have some sort of information on that.
Yeah. So first of all, because I'm a publisher in print, I've printed a big stockpile of the cards, some that don't have Stroke Smart Alexander on it. So I have about 500,000 wallet cards in a warehouse that I will donate really to any county, any city, any state. I mean, I'm completely neutral. So stopping stroke is a universal thing. So the cards are close to free. Um, the magnets cost, I've shopped a lot, but we can make the magnets for about 30, 35 cents. So that's what it costs for a magnet. The posters literally can just be done on, I mean, I do them on a fancy heavy cardstock, but they could just be done on color copiers and they're, a nickel a piece or something. So the physical material cost is really, really low. I'm happy as a service if some city wants to change the logo from Stroke Smart Alexandria to Stroke Smart Herndon or Stroke Smart Richmond. I'd happily do that for them.
So do you
So
feel like you have the capability to be a distributor for communities
yeah,
in the Commonwealth of Virginia at a lower cost than they would probably at any other place?
yeah, it'd be a fraction. I mean, literally, I can donate the cards to them for free. That's a zero cost, and you know, we're talking about photocopying costs.
That's excellent. Perfect. I'm going to put this presentation together. I'm going to package this because it's being recorded and I'll send it to you. But I'm thinking this is a great presentation of how to become stroke smart, how to make
Sure.
your community stroke smart. If you have an idea for the title, let me know. And I'm gonna make this kind of a package, just your section into one presentation if I can have your permission to do that.
Absolutely.
And then the other question I have is, um, do you incentivize your stroke champions? Like, do you give them a sense of being part of something greater than themselves? Like maybe a recognition from a group, like from the mayor or something like you are a stroke champion, you're an Alexandria stroke champion, or do you follow up with them with continuing education of how to continue to move forward rather than just you saying they're a stroke champion? I just think that that sense of community is powerful. Um,
That's
I'm just
that's
wondering.
great. That's a great idea. No, we've not gotten to that level, but that's a great idea.
Okay, great. Like a challenge coin or anything. You give them a little something to say that, this is who I am, and try to give them your identity as a stroke champion. Because I think if you define stroke champion, there's a picture of Alan Stillman because you're doing a great job. So you
Thank
need to
you.
make more Allens. Is what I would like to do. So, all
I
right.
really could. I mean, I've been doing this now about 20 hours a week for 3 years, and then before that, even many years for less hours per week. But if someone really wanted to be the lead for their city or a group of people, I think I could mentor them to do it pretty well and give them most of the materials at like close to zero cost.
Exactly. Okay. I'll get with you offline about doing that for the entire Northern Virginia region, and then see if we can expand it beyond. That sounds great. Okay, I'm done if someone else wants to talk. I didn't mean to hog the microphone. Thanks, Alan.
Sure.
So once again, thank you very much for a fantastic and inspiring and a passionate work where much work is still to be done. Hopefully we can make Stroke Smart Virginia, and there's a lot of interest, as Ms. Scott is already pointing out, and wondering about cards being made for Smart Stroke Virginia. Hopefully they can contact you offline with any interest, and thank you for being so generous.
Sure. My pleasure. My hope is I kind of half joke that, someplace out there, my grandmother now can smile.
All right.